Measles cases are ticking up around the country. Public health experts are worried about the dip in childhood vaccinations. In Sarasota County, the vaccination rate has slid to about 80% for kindergartners, which still sounds okay, but...
Scary. It's very scary and worrisome because the worst is coming.
Roughly 20% of kids are unvaccinated. Are you worried about sending your kids to school as vaccine rates tick down? I'm Matthew Petty, and coming up on Florida Matters, we'll talk about what's behind vaccine hesitancy in Sarasota County. And it's peak rainy season. That means mosquitoes are out in full force. How bad are the mosquitoes in your neighborhood?
Those are one of our major concerns for disease. Those can be different species. One of them is called Aedes aegypti. There's also Aedes albopictus. These often get called either the yellow fever mosquito, sometimes the dengue mosquito, chikungunya. They're different mosquitoes that breed near humans that like to breed in all of those things surrounding us, like buckets. And those are going to be the ones that typically prefer to bite humans.
We'll hear how Hillsborough County is working to eliminate these tiny but dangerous critters. That's coming up on Florida Matters. Childhood vaccination rates are plummeting in Sarasota County. About 80% of kindergartners county-wide are immunized against measles. That's a lower rate than neighboring counties and the statewide immunization rate. WUSF's Kerry Sheridan is covering the story and joins us now. Kerry, thanks for being here. Now, people hearing this may be thinking about the measles outbreak in Texas. How do vaccination rates in Sarasota County compare with what was happening there?
Well, Sarasota's rate at 79.9% is very close to the rate of vaccination that Texas had in the county that was affected. Their rate was right around 80 as well. So the level of immunization is low, and it's much lower than what pediatricians recommend.
What do they recommend?
It should be around 95%
okay.
of the population.
Because, 80 still sounds okay, but that's a sort of big enough gap for some of these diseases to sneak through?
Oh, definitely, yes. Because what they're looking for is herd immunity, so you want as many people as possible vaccinated against measles, for example, because it's very contagious. And once you have fewer than 95%, it can break through.
Were you surprised when you saw the numbers?
Very surprised.
Yeah.
Yes.
Now, is this a gradual decline, or has it been trending down for a while?
It has been going down for a while. It hasn't been sudden, but Sarasota, for example, is the second lowest county in all of Florida for vaccinations. And this is where I live, too, and where my kids go to school. So I was very surprised. It's a highly educated area. You know, it's fairly affluent in some areas, but that doesn't really seem to make a difference.
So measles is something that folks are probably thinking about just because of the outbreak that's happening basically across the entire country, but particularly in places like Texas where there have been some fatalities as well. What other diseases are physicians worried about with vaccination rates declining?
Well, measles is a big one because it is so contagious. 2 children in Texas died this year, and the country as a whole has had more than 1,300 cases of measles this year alone, which is pretty high, much higher than last year. Another disease that doctors are looking at is pertussis, which is whooping cough.
Whooping cough?
Yes, that is also on the rise in a lot of parts of the country.
I mean, these diseases, it's kind of a blast from the past, right? Even measles, it's a bit of a throwback to a time when they were still figuring out some of the vaccines for these things.
Yeah, it's something that a lot of public health experts think that, we had under control and we had solved these problems. But as fewer people vaccinate their children, they pop up again.
So as a journalist and as a parent, you're obviously a bit surprised, maybe a little bit alarmed to read some of the data and kind of dig more into the story. What are doctors saying?
Well, it was interesting that Suncoast Searchlight did a long investigative piece on this. They called around to 20 different pediatricians in Sarasota, and only one agreed to go on the record. I made a few calls as well. I couldn't get anyone to talk to me on the record. And doctors are concerned, but sometimes what happens is pockets of people emerge. So there are certain people who don't have trust in vaccines, and they will just avoid their pediatrician, or they'll go to a different kind of wellness center or a chiropractor or different ways. There you can always find online suggestions for ways to get around it. So the doctors are struggling with that because once they do have someone who's opposed in their office, it doesn't always go well.
Yeah. Now, you talked to Dr. Rana Alyssa, the head of the Florida chapter of the American Academy of Pediatrics. let's just listen to a little bit of what she said about the safety of vaccines.
It's very safe, it's very effective, and it's much better than having the disease. It's much safer. So we always recommend vaccination, especially when we have outbreaks. But regardless, we need to have vaccines. Vaccines are the safest tool.
All right, so that's the message that's coming from probably most mainstream physicians, it would be fair to say, but nevertheless, there's some pushback. What about the Florida Department of Health? What are we hearing from them?
The Florida Department of Health has not taken a strong stand on this. I asked them for an interview, and they declined. They sent me a statement that essentially said they empower parents to make the best decisions for their children, and they encourage them to consult a healthcare provider. But the Sarasota Department of Health didn't even mention the word pediatrician in their two-sentence statement. So that's disheartening for pediatricians. A lot of this is hard on them because they tend not to be the best paid profession in medicine. They believe in children's safety, and some of the rumors that are circulating online are things like that they're getting rich off immunizations, which simply isn't true. Right.
I mean, that sort of goes a little hand in hand with some of the other stories you're reading about people sort of worried about quote unquote big pharma, right? Like the drug industry pushing things on people who may not want them.
Yes, all manner of conspiracy theories there can be a Venn diagram of different things that people believe in, but it is difficult for pediatricians to confront this because it just keeps happening.
Yeah.
You can get out there and say, this isn't true, these are myths. You can try to connect with your patients, but ultimately they're still being bombarded by these messages. And, of course, the government, RFK Jr. leading Health and Human Services, has also injected a pretty heavy dose of skepticism about vaccines into the general thinking of things. So even people, if they're not really sure, they might have heard something and they become uneasy about it.
Yeah. Now, you talked a little more with Dr. Rana Alyssa about talking to parents who are resistant to vaccines. Let's just listen to a little bit of what she had to say.
It's not easy to talk to somebody who you feel does not trust you because you know the science, you know the data, and you're trying to do the right thing. And you see them blocking you in a way that they feel offended when you try to push for the vaccine. It's a matter of distrust. So we're talking specifically about the people who don't want their kids to be vaccinated. They do not feel that we should talk to them because they already researched it. They Googled it, and they watched it on Facebook, on Instagram. They have these videos made up by people who are not physicians, for sure, but they're chiropractors, by some people who claim that they are experts in the matter, but they're not. So they already made up their minds. And unfortunately, these people are increasing by number day after day.
I mean, it sounds from what Dr. Alyssa was saying that there's a real kind of trust deficit there that's pretty hard to bridge.
It sure is. And, she's the president of the Florida chapter of the American Academy of Pediatrics. She's not afraid to go on the record and say these things, but increasingly doctors are afraid because they're afraid of some kind of pushback online or harassment or threats. So it becomes a very difficult situation for them to solve.
Yeah, I guess there's also, if somebody's already made up their mind, it's very hard to change their mind otherwise. So pushing back just may not be very productive for physicians. People do often have very sincerely held beliefs, right? There are religious exemptions to vaccines in some cases. Talk to us a little bit about that.
Yeah, there are some people cannot get vaccinated. Some people can claim a religious exemption, but also there are children and adults who can't get vaccinated for medical reasons. They may have an immune disorder or maybe going through cancer treatments or different things that make them susceptible. So they cannot get vaccinated, and that's why herd immunity is important, because when you have most of the people vaccinated, it helps protect the people who can't be. And one thing that Dr. Alyssa brought up is that religious exemptions do exist, but most religions require you to be a faithful parishioner to, do what you can to support your community and make sure that everyone is healthy. And vaccination is a part of that. So religious exemptions in a lot of cases don't make sense in her view.
Have you heard any success stories in your reporting so far? Like, have you talked to any physicians who said, we have actually found a way to get through to folks who may be hesitant, but we've been able to convince them that this is a good idea for their kids?
Honestly, I haven't. I have not heard that story yet. I'm sure it exists, but for the most part, one pediatrician I spoke to said that she is involved in kind of a concierge practice where she selects the kinds of patients she sees and says, you must be vaccinated to be in my practice. And so she brings those kinds of clients to her. So the people that don't want to be vaccinated are not seeing those doctors.
Right, they're sort of selecting themselves out. So this is happening in Sarasota County. Do you have an idea of why it's happening in this part of Florida?
That's a great question. I know that Sarasota put forward 4 different medical freedom candidates to be on the hospital board last year. They did lose that election, but there does seem to be quite an interest in Sarasota, particularly in the southern part of the county, in medical freedom. There's a We the People Wellness Center that's opened up. People who believe that perhaps what they've been told by mainstream medicine isn't the best for their health, so they want different options, and not vaccinating children can be a part of that. So that is kind of a popular idea in parts of the county.
Are there physicians who've kind of turned to social media to try and get their message out and counteract some of the information that folks are getting from social media?
They do. Dr. Alyssa said that is part of what they're doing. They have meetings about it, strategy meetings. They just had one among pediatricians across the country about ways to combat this. But it's almost like those silos that we hear about. How do you break into someone else's silo with information that they've become very hostile against?
Yeah, because, traditionally a physician, a family physician would be somebody you have a relationship with that's kind of built up over time. You trust them, but that is kind of broken down.
Definitely, yes.
In the last 30 seconds or so we have here, Kerry, what are you looking for in the story next? What are you following?
Well, I'm interested in looking more at what the trends are, where those exemptions are mostly located, how parents are going about them, and of course, the story none of us wants to cover is when will there be an outbreak, because we did have 8 or 9 cases of measles in Florida last year. This is an area that is definitely ripe for an invasion of measles, so that may be the next step.
Kerry Sheridan with WUSF has been reporting on the dip in vaccination rates in Sarasota County. Thanks for being with us. Coming up on Florida Matters,
we've had a huge surge in what are called salt marsh mosquitoes, and that's going to be due to weather. Those are those mosquitoes that are right around the coast. We have so much coastline in Hillsborough County and all of Florida. Those mosquitoes are going to be particularly aggressive and flying around, and they can fly quite a large distance. They're going to be what we consider a more aggressive nuisance species.
We're talking about mosquitoes. How bad are they in your neighborhood this summer? And what are your concerns about mosquitoes? You're tuned to Florida Matters. I'm Matthew Petty. We're in peak rainy season in Tampa Bay right now, and that means mosquitoes are out in full force. Scientists have some high-tech tools at their disposal. It turns out AI is not just for creating deep-fake videos or helping write assignments, it's also being deployed to help track disease-carrying mosquitoes. WUSF's Lily Belcher tells you the next time a mosquito lands on you, before you swat it, take a picture of it.
Researchers from the University of South Florida are asking you to upload photos of the annoying insects to their mosquito dashboard. They will be analyzed by artificial intelligence to identify the type of mosquito and track those that could be carrying diseases. Ryan Carney is leading the project.
So it's very, very critical for us to be able to determine what the exact species is, especially those that are called vector species that transmit disease, as well as those that are invasive.
He says not all mosquitoes carry deadly diseases like Zika, dengue fever, and malaria, but it's important to detect those that could.
WUSF's Lily Belcher with that report. Mosquito control also relies on tried and true methods, spraying pesticides and making sure there aren't places for them to breed. Joining us now is Gabriella Henderson, Community Relations Coordinator with Hillsborough County Mosquito Management. Thank you so much for being with us.
Thank you so much for having me.
All right, so people in Hillsborough County might have noticed a bit of a surge in mosquitoes in the last couple of weeks. Is this one kind of mosquito that they're seeing out there?
Yes. In some cases, there could be tons of different kinds. We've had a huge surge in what are called salt marsh mosquitoes recently, and that's going to be due to weather. Those are those mosquitoes that are right around the coast, right along. We have so much coastline in Hillsborough County and all of Florida. Those mosquitoes are going to be particularly aggressive and flying around, and they can fly quite a large distance.
So these are kind of big and they're a bit painful, right, when they bite you?
Yes.
Yeah.
They're going to be what we consider a more aggressive nuisance species, and there's a couple of different types. We actually have about 3,000 or so species of mosquitoes worldwide.
Yeah.
There's not just one type of mosquito, and in Hillsborough County we have about 40 to 50 different species. So those are just a couple.
All right, so quite a lot of different mosquitoes. What are there some that we're seeing more of than others? I mean, I notice that I see a lot of those little stripy ones.
Yes. So those are going to be our container breeders. Those are going to be mosquitoes that like to kind of grow up near us. Those are one of our major concerns for disease. Those can be different species. One of them is called Aedes aegypti. That's one that gets talked about a lot. There's also Aedes albopictus. These often get called either the yellow fever mosquito, sometimes the dengue mosquito, chikungunya. They're different mosquitoes that breed near humans that like to breed in all of those things surrounding us, like buckets, tarps that have little bits of water in them. And those are going to be the ones that typically prefer to bite humans.
Okay, so in rainy season, I mean, you may not even have a pond near you, or it may not be like a retention pond or a lake or anything like that, but it doesn't take much for these mosquitoes to breed, right? So what are we talking about here in terms of things you should be aware of in your backyard?
Exactly. So like you said, it does not take much at all. It takes about an inch of water for a mosquito to go through its whole life cycle. So you want to go around your yard and look for anything like a dip in a tarp that's collecting rainwater, a bucket, kids' toys that get left out and after the rain. And you're going to want to look for any type of mosquitoes. Now, a lot of people think of mosquitoes as that adult mosquito that flies around and bites us. Unfortunately, they go through a whole life cycle just like butterflies. So they're going to be laying their eggs in the water. That's going to look like almost wiggly, small worm-like things. Those are called mosquito larvae. Those are going to be what you want to kind of catch and dump out the water with those in them so you can interrupt that process before they ever become the adults that bite us.
Yeah, I'm pretty sure I've seen those. They're quite distinctive once you actually get a glimpse of them. Like they're kind of wriggling around like little tadpoles or something.
Yes, exactly. There's a couple stages. The larva and the pupa happen in that water, and they can look like either tadpoles or almost tiny little worms that wiggle around a ton.
Okay, what about other kinds of method of control? So if you've got an outbreak of, say, the salt marsh mosquito that you're talking about here, how do you get a handle on that?
So once they've become adults, we use what we call adulticide. So that's going to be product that's targeted for the adults. That's going to be spraying via trucks or air in order to get those under control. It's actually a very small amount of product. It's about an ounce for an entire football field. So it goes a very long way. We try to use as little as we can while still being effective. Prior to that, if we can get ahead of it, so if we say we have a big rain and the weather the next day is favorable, that's when you might see our helicopter going around and doing what we call larviciding. So that's going to be trying to attack the mosquito in that larval stage, that stage we kind of just mentioned. That's when they're really, really hungry, similar to the book, The Hungry, Hungry Caterpillar. They're going to be eating tons, and that's when we can use our larvicide product to help get them before they hatch out.
Okay, I got a few more questions I'm thinking of in terms of spraying, but are you able to give people advice about how to maintain a water-free yard, so to speak?
It's definitely very tricky in Florida when we have rain every single day. Fortunately, that life cycle for that mosquito does take a couple of days. It can take about 7 to 10 days. So as long as kind of somewhere in there you're able to try to dump some water out, try to catch any breeding. Unfortunately, there's not a ton of things we can do aside from dumping that water, getting rid of that water. We do use something called BTI, which is a bacterium. That's what kills the larva. There are things available like that at Home Depot, similar products like those dunks that you can put in buckets or bird baths, anything like that. That might be your best bet, but unfortunately, the best thing to do is getting rid of the water. Unfortunately, that's very complicated in Florida.
You're listening to Florida Matters. We're talking about mosquito control with Gabriella Henderson with Hillsborough County Mosquito Management. If you can't kind of control the mosquitoes in your environment, you can maybe do some things to keep yourself safe. What should you do?
Exactly. So there's lots of different things you can do. You can try to avoid going out at what we consider peak mosquito times, dawn and dusk. You can also wear longer clothing. So I know it's pretty hot in Florida. We don't necessarily want to be in long sleeves, but if we have those lighter, thinner long sleeves and loose-fitting clothing, that's going to be a huge help. Mosquitoes can't bite through that very well. You can also do use things like products that have DEET in it. That is going to be one of the kind of only approved things to use to prevent that, to keep the mosquitoes from coming to you.
Sure.
There are other products as well similar to that, but like DEET, something called permethrin. So those sprays, but if you don't feel comfortable with those sprays, trying to avoid any dawn and dusk, wearing those loose-fitting clothing, and sometimes different plant smells can also push them away, but it has to be the smell, so that smell coming off of plants like sage, rosemary, things like that.
So that'll actually work. I mean, what about things like I see people using a little bucket with a candle in it with like citronella? Does that actually have any impact on mosquitoes, or mosquito coils? Do those things work?
They do. They work only up to a certain extent. So citronella is really great to prevent some mosquitoes from finding you, but it does attract other mosquitoes, unfortunately.
Okay, hang on a minute. So citronella is actually bringing some species in and repelling others?
It can, yes.
Okay, which ones does it get rid of and which ones does it attract, do you know?
I don't know specifically, but that's a great question. That's something I'll have to look into.
But on balance, it might be safe not to use it unless you're absolutely sure which kind of mosquito you're trying to keep out of your yard.
Exactly. It should be pretty good at pushing away the ones that prefer humans. So kind of like I mentioned, those different species, not all of them like us, not all of them want to bite humans. Some of them prefer birds, frogs, other things they can find more easily. So the ones that prefer humans, like those, what we call the 80 species of container breeders, the citronella does work pretty decently with them.
Yeah. So I've seen people using those zapper lights. Are they effective?
They can be, yes. We actually use zappers near our office as well, because we're in a place that has a ton of mosquitoes. So those zappers can be effective. The citronella, but really that spray, anything with DEET is going to be the most effective. That's something you want to put on your clothes, not on your person.
DEET?
Yes.
Okay, so because I do see spray with DEET in it that you're supposed to spray on your skin too. Is that a bad idea?
So it depends what product you're using. All of those products have been EPA approved. So our biggest phrase is kind of label is the law. So you always want to follow what it says.
Okay. Now, if you're going around a neighborhood with your truck and you're spraying, or you're coming in with a helicopter and spraying, is there a risk you're going to get rid of some of the other mosquitoes that maybe the other animals rely on? Because this is all part of a food chain, right? And I know people look at mosquitoes and think these are just a nuisance, get rid of them. But is there a kind of a balance you're trying to maintain here? How do you deal with that?
So basically, for those spraying, depending on at what we're using, the truck, plane, things like that, those are going to be very targeted, and those are going to be for any of those mosquitoes flying at night. We do it during a specific time, so we can only spray between sunset and sunrise in order to prevent kind of getting any other insects or any other species we're not looking to target. And that's one of the things in Hillsborough County specifically we do, is we really try to go out beforehand with that larvicide to prevent those hatch-offs and only spray when we need to.
Do you get some pushback from folks when they see the chopper going over, or they see the spray truck? They're like, I don't want this stuff in my neighborhood.
Yes. We get very kind of conflicting responses. A lot of people understandably are very concerned, and that's why we list everything we use on our website. You're able to go to hillsboroughcounty.gov/mosquito, and you're able to see anything we use. Some people love us, especially by the coast. We do get some questions about our helicopter because it does have to fly very low.
And this is going over at nighttime?
The helicopter will be during the day.
Okay.
That's going to be targeting those early stages, that larvicide.
Okay. You mentioned something called dunks before. This is like a little tablet or something, right? Can you tell us a little more about that?
Sure. So those are going to be made of something called bacterium. It's a BTI, and that is a bacteria found in soil. It's naturally occurring, and it basically breaks down the larva's stage. So Mosquitoes in that second stage of their life cycle, that larva, they're eating as much as they can to get ready to turn into an adult. So that has that bacterium and it breaks down their gut and they're unable to turn into an adult.
Okay. And I mean, I see a lot of people with kind of nice looking yards. They've got a lot of bromeliads, which are the plants that kind of capture a lot of water in them.
Yes.
Presumably you don't want to go through your yard and just rip out every single plant that's going to trap water. What can you do about those? Is there a spray you can use? Should you be getting those dunks and like crumbling a little bit into each individual plant? Because that sounds like it'd be quite time consuming.
That could definitely be time consuming. Unfortunately, there's not much aside from targeting it without getting rid of it. Mm-hmm. So if you want to keep it, you can crumble those dunks. You can also put a little bit of like oil, cooking oil, things like that. Mm-hmm. That will create a surface at the top of the water where the mosquitoes can't breathe. So while mosquitoes go through their whole life cycle in the water, they still need air. And if you put that oil on top, it'll keep them from being able to breathe, and that should get rid of them.
Okay, so you can get like a cooking spray or something, just go around and spray those plants?
Yes, and that little pocket where the leaves overlap and it's catching that water, you can put it in there.
Mm-hmm. Have you tried that yourself?
I haven't. I don't have bromeliads near me.
Okay.
But I know some of our inspectors that go out in the community have done that.
Uh-huh. Just quickly here, Gabriella, what's this season like compared to previous seasons? Are we kind of about on par? Is it any worse than it's been in other years?
It's been particularly worse for what we call our salt marsh species. Mm-hmm. So because we had a little bit of that drought, salt marsh mosquitoes, they lay their eggs in damp soil. And once that soil floods, they all hatch out. But those eggs can last for a very long time. Okay. So without those kind of usual rains, they weren't going through their whole life cycle. Until we suddenly got tons more rain. Right. So we're seeing a huge emergence. Yeah.
We've been speaking with Gabriella Henderson with Hillsborough County Mosquito Management. Thanks for being here. Before we go, we'd like some help with upcoming episodes of Florida Matters. If there's something you've always wondered about Tampa Bay or a story that you think needs to be told, let us know. If you've got ideas for what you'd like to hear on Florida Matters, reach out by phone or email. Call 813-755-6562 and leave a message, or email floridamatters@wusf.org. That's our show for today. Florida Matters executive producer is Grayson Doctor. Our producer is Amelie Horace. Editorial guidance from Mary Sheridan. Our engineers are Dave Anderson, Jackson Harp, Gio Galvin, and Blake Bass. Subscribe to Florida Matters wherever you get your podcasts and watch on WUSF's YouTube channel. I'm Matthew Petty. Thanks for listening.